shouldn't say services. We provide ventilation with a ventilator, and then we also do things with medications that other floors can't do. We do things with what we call vasopressors, which are medication drips, and we titrate those basically to raise or lower blood pressure. So you have vasopressors to raise blood pressure, and then we actually have medications that lower blood pressure. And then we also sedate patients and put them on ventilators. So we're tinkering with several sedatives to try to get a patient to be relaxed and not remember anything about being on a ventilator. And then we're also dealing with their hemodynamics. Maybe their heart rate's too high, their blood pressure's too low. Those are kind of the things we encounter a lot of. So typically we have anywhere from 1 to 3 patients. So when I come in to work, a typical day would be I go get kind of my supplies that I'm going to need, stethoscope, and just other various things, scissors, XYZ. And then I'm going to get a overview of what's going on in the ICU. Who are our most critical patients? Is there a violent patient on the floor? Are we not letting family in for a particular patient? Things like that. And then...
Wait. I mean, you just threw something in there that, like, I almost started laughing. Like, you actually have to worry. Are there patients that might attack the people that are trying to give them medical care?
Oh, 100%. I came in just 2 weeks ago, actually, and typically I'm the nurse that they give these patients to. Though I will say at this particular hospital I'm working at now, it's not as bad. But oftentimes we'll have patients, it's very common for a patient to be restrained, first of all.
What?
Yeah, so if you're ventilated, the chances of you being restrained are very high. That said, you're not going to really remember being restrained, okay? And what actually happens a lot of times is, which is actually good, a patient will, even when they're sedated, the instinct is to reach up to your breathing tube, right? Your breathing tube is connected to a ventilator, and then the ventilator is the machine that sustains your life. But when you wake up, because sedatives are tricky, man, it is a ball game of keeping somebody down to the point where you can wake them up and talk to them, but you don't want them too awake, but you also don't want them what we call snowed, right? Because what will happen is they wake up and their instinct is to pull their breathing tube out. And now all of a sudden, if your patient pulls their breathing tube out, they have sedatives running. You've probably heard of propofol from Michael Jackson. That's what he was getting to sleep. If you have that running, that suppresses your ability to breathe. And now all of a sudden, you just took out your lifeline. So alarms will go off, and you've got to like throw some other oxygen via like a face mask on before these people die. I mean, this is something that happens. A lot we call it self-extubation. So to counteract that, you tie somebody's wrist down. But to your point, you're talking about just a straight up violent patient. Absolutely. Somebody could be an alcoholic that's withdrawing, or perhaps they had a stroke that's kind of altering their mental state. And you have to tie not only their arms down, but their legs down. And then you have to have a nurse in there 24/7 to make sure they don't do anything stupid. And I've even got into several physical confrontations with patients. Probably the most recent one is a patient was standing on a bed. He was a younger guy. He had a full cardiac arrest, and he got resuscitated. And he went through this whole thing that I could tell you about. It's called hypothermic cooling, where we purposely essentially raise the or lower the body temperature of the patient for 24 hours, I want to say, and then slowly rewarm them up. So this guy went through this whole process. So physically, man, he was a young, strong kid. He was totally coordinated, but his mind, he did not know where he was at. And it got to the point he punched his mom in the room, and then he punched or at minimum, because I didn't quite see it, the lights were off, swung and hit a nurse to where her face was
oh my
God on the
God.
side. So I'm like, click the lights on, you know, I hear this ruckus because security had actually just left because the dude freaked out already. And security's like, everything's fine. They got the kid back in the bed. Within 5 seconds, he's back up, flinging bombs at people. So this is where like my experience with jiu-jitsu comes in handy. But I grabbed that dude. I reached across, I almost like bear hugged him because he's standing on the bed, reached across, grabbed his far side arm, and then switched arms and grabbed his wrist, and then went kind of underneath his legs, and almost like you're cradling a baby, and then elevated him, slammed him, and then pinned his wrist to his body. And then he is looking at me, bro, like completely flexed, like saliva coming out of his mouth, wanting to like tear my head off. And I'm like, get the restraints. And his mom's like, his wrists are bruised. I don't want the restraints on. And at that point, it's like, ma'am, I don't give a shit. We're restraining them. You know what I'm saying? So, yeah, we deal with violence. But I veered off course a little bit. But,
I mean, it's my fault. I'm the one that called it off there because I got to tell you that there's no part of my day that's going on right now where there's even the slightest chance that would happen, right? Because I am isolated. Right. I'm coronavirus lockdown.